Hello, 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 hello. Mwah. One more hello to you. How are you, my beautiful people out there in YouTube land? How are you this blessed Friday afternoon? TGIF. Thank God it's Friday. Amen. Some people are not saying it, because Friday is like any other day for them. But for those persons who have been working all week and looking forward to a weekend, where they don't have to work but relax and rest. I know you're saying TGIF. Thank God it's Friday. Yes, today, guys, it is Friday, June 26th, 2020, and you are watching Omega Live with JJ, Woman Without Borders. Mwah. Thank you for watching. If it's your first time, a very special welcome. Mwah. Thank you for watching. Share the link, share the link, share the link, share the link. Guys, I tell you all the time, knowledge is nothing if it is kept to yourself. Knowledge must be shared, it must be applied. And so you must share the link with your friends and family that they too can come and partake of this program and to learn something new. Because I promise you, you're going to learn something new today. Yeah, absolutely. I promise you're going to learn something new. I have a lot of information to share with you. And so you want to grab a pen also, because I'm going to have some information that's going to require you to write things down. So you're going to need to have a pen and paper, right? Or if you're using your smartphone, you get to the notes section of your phone and get ready to write. Absolutely. All right, guys. So as you know, I'm also on Facebook, Twitter, and Instagram. So you can also go over there and like, share, and comment. And I invite you to subscribe. Hit that subscribe button, guys. Hit that subscribe button and subscribe. I know that I have problems sometimes with YouTube because YouTube is not giving me the correct algorithms, and people are even giving me thumbs up and it is not showing up. I don't know actually if it is only YouTube the problem, but I know that they are partly to be blamed because they already told me about how their system basically is automated. They have these bots which are basically programs that have been designed, right, and to monitor, right, the viewership and to monitor persons who actually give thumbs up and things like that. You understand? And they weed out because apparently it's a situation, it's a case, it's a war, guys, bot versus bots. Because you have unscrupulous persons who go out and they also design programs that cause negative effect on the internet, right? And so then where some of them are called viruses, right? And so you find that you also have programmers have to write programs that counteract these other programs, right? That are bad for the internet and for bad for users. And so I cannot understand. On the one hand, I understand where they're coming from, but on the other hand, I keep telling them, I said, my viewers are real people. They're not bots watching. They are real people watching. Okay, and so you need to give me my correct algorithms, right? So it is what it is, guys. I'm just happy and thankful that I'm able to be on YouTube to basically do this live stream where you can actually see me in real time. Yes, in real time. It's now 4 minutes past 12 o'clock. Okay, I'm in Jamaica and you're watching live broadcast. Absolutely. And so, guys, you know the drill, right? I give you the news and then I give you my 2 cents, all right? My commentary on it. Okay, there are my views. Okay, and I would like to think they are informed. I just don't speak arbitrarily, right? I have a certain amount of intelligence that the Lord has given unto me, and He has done the same to you. And so that's why I give you the news so that you too can make informed decisions, as we are all students of knowledge, right? Absolutely. And so without further ado, I'm going to go right into the news to let you know what's happening here in Jamaica and around the world. Yeah. So Jamaica now has 684 confirmed cases of the coronavirus disease COVID-19, according to a press release issued by the Ministry of Health and Wellness. The 6 new cases are 2 males and 4 females, ages ranging from 6 to 35 years of age. 2 are from Westmoreland, 1 from St. James, 1 from Kingston and St. Andrew, 1 from Hanover, and 1 from Trelawney. 4 arrived on flights from the United States of America, and 2 are contacts of a confirmed case. And so, to give you the data for my big data people, we have a total now of 22,712 samples that have been done to date as a result of the 451 new samples that we had. And of course, out of that, like I said, 6 came back positive, and we have a total sample negative sample of 21,965. Right. Meanwhile, we also have 5 recoveries. So 5 persons have also recovered from the COVID-19. Not a death sentence. Yeah. We have nobody critically ill, nobody moderately ill, right? Although we do have 13 persons who are hospitalized. And of course, our total number of recoveries now is now 526, or 521. With these 5 new cases of recoveries, we are now up to 526. Okay, there are 43 persons who are in government quarantine. 135 who are in isolation, and in 135 in isolation, it means those who are in home isolation and government isolation. You understand, right? Persons basically who have tested positive for COVID-19 would have been isolated, right? But of course, because of the lack of facilities, they all can't be in government isolation. And so some of them are in home isolation. So that 135 encapsulates those persons, yeah? Okay. And of course, we have persons who are in home quarantine. So, when you return to Jamaica, guys, as you understand that you would have been placed in 14-day quarantine, right? And you would have been geofenced and put a bracelet on you like a criminal. I gotta say it because some persons don't seem to understand what is happening here. You understand? And as I've been telling you, and you guys are not seeing it, this country is becoming very much militarized, and our freedoms are being taken away from us, all in the name of COVID-19, which has only claimed 10 lives to date in Jamaica, regardless of what is happening overseas. Yeah. So, anyways, we have 2,441 persons who are in home quarantine, being geofenced and bracelet. And of the 684, we have 319 who are females and 294 who are males. To date, as a result of those imports, we have 171 persons who are imported cases and 231 who are contacts of confirmed cases, which means that we only have 39 local transmission, guys. And of course, out of our big numbers also, 236 persons are from Alarica call center, and 7 persons are under investigation, meaning that they don't know exactly how those 7 persons caught the virus. That's the point. Yeah. So that's the number, guys, for my big data people, right? Meanwhile, the southeast region. Oh, before I continue, just 1 cent on this one, not 2 cents, 1 cent. I just want to point out something to you guys, in case you didn't realize. So you notice I said to you, these 6 cases, ages ranged from 6 years to 35 years. So what is happening here now, guys? This is what is happening. Guys have to be very careful. And I said this to you before. Go back into my broadcast, guys, and watch my previous episodes when I talk about this, how I talk about the chain of infection. A chain is only as strong as the weakest link. You break a link, the chain is broken. All truth is parallel. If you break the link of infection, then you cannot have an infection, right? And I told you about the portal of entry and the portal of exit, as we have been taught. This is how the infection enters your body, through your nose and through your mouth. So that's why you wear the mask. Now, here it is, guys. If it is that you're coming into the country, and I can understand, you're coming back into the country and you're excited to see your loved one. But I'm sure you do not want your loved one to die or to be ill, right? So it is not too difficult a request to ask you to please ensure to wear your mask. If you have your mask on, there can be no portal of exit. And if the child has the mask on, there can be no portal of entry. Yeah? You're glad to see it. And you cannot ask a 6-year or a 10-year-old child that this child must be practicing physical distancing. Children don't understand. Their cognition is not at the place where they understand what's happening with COVID-19 at this point in time. So if they have not seen their mother, father, sister, brother, whoever for a long period of time, and then they see, they're going to want to run to you, hug you, and all manner of things. And you can't stop the child from doing that. It's natural. But you can, as an adult, you can protect your child. And here to see a case, this is the context of a confirmed case. And I can guarantee you, it's due to the fact that either person was not wearing your mask, right? You have to wear your mask, guys. This is the point. And until we're told other, because it's a novel coronavirus, novel means new, and so the characteristics of of this disease is more or less unknown because, as I said it before, and I maintain it, it is man-made in a lab, and so it is pretty new. People are learning about it. They don't know everything about it. But one thing that we have learned so far, that so far as we know, that's how you contract it, by your nose or your mouth. So I am saying to you guys, if it is coming back into the island and you have loved ones you have to greet, ensure that the loved ones are wearing their mask and you're wearing yours too. And that way you cannot infect your family with the virus. That's what we're saying. That's not too hard to do, is it? Come on, guys. Yeah? You're coming back. That's fine. You're happy to see your family. That's fine. But you cannot expect a 6-year-old. A 6-year-old does not understand to practice physical distancing. It's a 6-year-old. And here it is now. You have infected the 6-year-old child with the disease. That's not nice. I know it was supposed to be a 2 cent and I gave it more like a 5 cent, yeah? Anyways, continuing. Meanwhile, the Southeast Regional Health Authority, SERA, yesterday morning began community surveillance in West Kingston following recent confirmation of 5 cases of COVID-19. The persons are contacts of a confirmed case that recently returned to the island from the United States. So that means these persons are a part of the 231 contacts that we have in the island at the moment. Yeah. Sarah says some 100 health staff, including nurses, public health inspectors, public health nurses, and community health aides, conducted house-to-house visits and assessed residents for respiratory symptoms. Residents with symptoms and those deemed to be at high risk will be tested for COVID-19 and quarantine orders served. The authority says groundwork in the community started, yesterday as personnel, and when they say yesterday, they're actually referring to Wednesday is when the groundwork actually started. As personnel from the Kingston and St. Andrew Health Department began its health education and community engagement program, and this will basically continue. It will be ongoing. Community surveillance activity was supposed to be completed yesterday. So they were supposed to have completed it yesterday. I've not gotten any new update on this report as to whether or not that was done. Nevertheless, the front page of today's Gleaner, let me show you. Yeah, can you see? The front page, yeah? That's the front page of today's Gleaner. See the headline, guys? Quarantine fears. Quarantine fears. Vendors worried nearby COVID cases could hurt Coronation Market sales. That's today's Gleaner front page story. It says vendors at the Coronation Market in downtown Kingston are concerned that with the health authorities carrying out extensive contact tracing in communities nearby, sales could dramatically plummet in the coming days as shoppers avoid the area out of fear of contracting the coronavirus. They fear that if the area is placed under quarantine, it could cripple them financially as they have been battling slower than normal sales since the island recorded its first coronavirus case in March. Yesterday, the Sarah, right, was in the West Kingston area conducting surveillance work following the recent confirmation of at least 5 cases in the area. The Gleaner has learned that the infected persons are contacts of a confirmed case, someone who recently returned to the island from the US. With tomorrow being the next major market day, that's Saturday, right? Some vendors shared their concerns with the Gleaner yesterday, Thursday. If them drop quarantine, we can't come out here and nobody will come, vendor Michelle Ling said. They're going to be afraid. We have to be careful because 5 people can spread to everybody. And I'll rest there. Okay, so by this, we would have realized because the surveillance would have been completed. We don't know what are the outcomes from that investigation, but today we would have heard, and then unfortunately, I will not be on tomorrow because tomorrow is Saturday. I'm off tomorrow until Sunday. But definitely, if you have not heard by Saturday, I will definitely have the information for you on Sunday when we meet at 1 p.m. Right? Sunday is 1 p.m. Okay. So, but just to say, I can almost allay the fears of these vendors and let them know, hello, it's in West Kingston, right? That is supposed to be the Tivoli area. Yeah. I can almost guarantee you that they're not going to be doing any quarantining in that community. Yeah, I'm not going to put my head on the block, mind you, but I can almost guarantee that they're not going to be quarantining Tivoli Gardens. Yeah. But again, you see, guys, contacts off, right? These are contacts of confirmed cases. You're coming into the island, guys, and remember, and this is what I don't understand, though, because there's just so much anomalies, and there's just so many questions. These stories and these data that you're giving give us, room to pause. It really caused me to think, and every well-thinking person I know is supposed to think also. Yeah. These persons came on a flight. They come on a plane. And they did not know that they had COVID-19 on the flight. Right? They're on a flight. What happened to all the other persons on that flight? Well, that means they're not eating on the flight, of course, because they would have had to take off the mask to eat, right? Because even if you went, you would have had to go on the plane with the mask. But I'm sure on the plane, at some point, the mask would have come off. Yeah? So what happened to all these persons who are in contact with these persons on the flight who are confirmed cases? They wouldn't have known then that they were confirmed cases until they came and did the test. Yeah. Yeah. I know. I really wish I really wish I had some really serious investigative journalists in this country. Yeah. It's so sad. We have very few really serious investigative journalists in this country. Very, very sad. And also tell you that the Ministry of Health is very concerned. They are reminding the public of the need for increased vigilance in the maintenance of the quarantine orders that have been issued to persons who recently returned to the island. They want to remind you that you must wash and sanitize your hands frequently, wear your mask in public spaces and around persons who are in quarantine, cover your mouth when you cough, right? And dispose of that tissue that you would have used, right, in the nearest receptacle, and sanitize frequently areas in your home. Like I teach my students, practice infection control measures, which includes washing of the hands and the cleaning of your surfaces. Absolutely. Members of the public are also reminded that when persons return to the island and are in quarantine, other members of the household are to maintain at least 6 feet distance and ensure that the person is kept apart from individuals at risk in the household, such as persons who are elderly, persons with comorbid illnesses such as hypertension, diabetes, and asthma, and persons with respiratory illnesses. Yeah? Okay. So, continue with the news, guys. I want to give you some information, so listen carefully to this one. And this is specifically for persons on the island or persons who are going to be driving and who are drivers and persons who are driving around the island. The Ministry of Transport and Mining is seeking public feedback on proposed increases to toll rates. They want to increase the toll, guys. So here are the proposals for Highway 2000, that is the road that we drive on when we're leaving North Coast to South Coast. So we leave, for example, from Montego Bay to Kingston.